It's Medicosis Perfectionalis. This is my premium CNS pharmacology course, lecture 2. Let's talk about benzodiazepines. With that said, now let's get started. Let's start with a case. This is case number 8. By the way, you will find all of the cases in the PDF that you have downloaded with the course. So, I'll leave you to read it, so please pause. Let's dissect that. So, my head keeps moving on its own. Involuntary repetitive movements. The patient's head turned to the right and she could not return it back until 7 minutes later. What is the diagnosis? And the answer here is, this is dystonia. Tonia means the tone of the muscle. Difficulty, problem or a disorder of the tone of the muscle. Question number 2, same case. Which of the following medications could have led to this patient's condition? Please pause. And the answer is, choose any typical antipsychotic. If you remember the previous video, what is the cause of psychosis or schizophrenia? It's associated with increased dopamine in the brain. How do you treat psychosis or schizophrenia? Decrease the dopamine in the brain by antagonizing the D2 dopamine receptors. Chlorpromazine will antagonize the D2, leading to decrease the action of dopamine in the brain. When I have decreased effect of dopamine in the brain, what will I get? Everything is slow. My muscles do not move well. That's the dystonia. Question number 3, same patient. How can you treat haloperidol-induced acute dystonia? Not just haloperidol, but it could be also chlorpromazine, fluphenazine, etc. Any typical antipsychotic. And the answer here is benztropine. My muscles are weird. They are kind of contracting and stiff. Relax the muscle by giving something that's atropine-like called benztropine. Benztropine is anti-muscarinic. It will antagonize the neuromuscular junction so that your muscles relax. How about dantrolene? Dantrolene is the treatment for neuroleptic malignant syndrome or malignant hyperthermia. And just to remind you, from the previous lecture we have said schizophrenia or psychosis, I have tons of dopamine at the mesocortical limbic. What will antipsychotics do? They will decrease dopamine effect by antagonizing D2 dopamine receptor. As a result, everything becomes slow. These are called extrapyramidal symptoms. Dystonia is one of them. How do I treat the dystonia? Benztropine to relax the muscles at the neuromuscular junction by inhibiting acetylcholine muscarinic receptors. And now to today's topic, benzodiazepines. We call them sedatives and hypnotics. They make you calm down. Let me tell you about GABA, gamma-aminobutyric acid. It's an inhibitory neurotransmitter. Let's say that organ A supplied GABA to organ B. GABA is inhibitory, therefore organ B will be inhibited, as you see. But if we do double inhibition, what we call disinhibition, A will inhibit this, and this one will inhibit this. Inhibition of the inhibition is excitation. The negative of the negative is positive. The loss of the loss is a win. So while it is true that GABA is inhibitory, the net effect could be an excitation due to double inhibition. Let me remind you, sodium influx equals depolarization, which is activation, but potassium efflux is hyperpolarization or inactivation. Moreover, when the chloride enters into the neuron, this is hyperpolarization or inactivation. Think of it this way. When the positive enters, it's activation. When the negative enters, it is inactivation. So, we are talking about sedatives and hypnotics. We want you to calm down. We want you to be inactive. How do you think they will work? They will open the chloride channel so that chloride comes in, causing inactivation. Just calm down, baby. Calm down. We have 3 types of GABA receptor, GABA A, GABA B, and guess what? GABA C. Which one is included with benzodiazepine barbiturates? They act on GABA A. Baclofen, a muscle relaxant, acts on GABA B. Benzodiazepine and barbiturates have nothing to do with GABA C. So let's talk about GABA A, which is the most important because benzodiazepines and barbiturates act on it. It's ligand-gated ion channel. Perfect. Yeah, what are the ligands? The benzo and the barbiturates. No kidding. They allow chloride entry. When chloride comes in, hyperpolarization or inactivation so that you calm down. GABA B, G protein coupled, specifically GI, which means it decreases cyclic AMP because I is inhibitory. This will lead to increased potassium efflux, decreased calcium entry. No calcium, no contraction. Baclofen is a muscle relaxant. GABA C, it allows chloride entry into the cell. Of course, this is inhibition. It's a subtype of GABA A, but it's a subtype that has nothing to do with benzos or barbs. You can find it in your retina or superior colliculus, which has a visual function. Superior colliculus, vision. Inferior colliculus, hearing. GABA is an inhibitory neurotransmitter. What are the drugs that act on the GABA? Benzodiazepines, that's why they make you calm down. Non-benzos, they make you calm down. Barbiturates, they make you calm down. How about mipромate and whatever, propofol, all of these will make you calm down. Even the inhaled general anesthetics, their function is to calm you down. That's an inhibition. Therefore, we use them in to make you calm down. Sedation, hypnosis, calm down, anti-anxiety, anti-seizure, amnesia, as muscle relaxants and anesthesia. Doctor, I have a patient with status epilepticus. It's not going anywhere. Give benzodiazepine. They are inhibitory, so the patient will calm down. I have an agitated patient that's hitting the doctors and the nurses. Give benzodiazepine. He will calm down. Doctor, I have a patient with fever, muscle rigidity, agitation. It's also known as neuroleptic malignant syndrome. Give benzodiazepine and dantrolene and he will calm down. What is this GABA receptor? GABA A specifically is a receptor like this, has 5 subunits. Perfect. This is the GABA binding site, so the GABA will bind here. Okay, with the GABA, benzodiazepines can bind here. With the GABA, barbiturates can bind here. What is the net effect? Hyperpolarization or inactivation. How? By allowing chloride to enter through this chlorine channel. Question. Can the benzodiazepine open the chloride channel without the GABA? Nope, it cannot happen. This is similar to you renting a safe box in a bank so that you can put your valuables here in a safe place. This safe cannot be open unless we have 2 keys, your key and the banker's key. Those 2 keys together can open the safe. Your key alone is not going to do anything. Benzodiazepine alone cannot open the chloride channel, but benzo and GABA, yay baby, we can open it. Barbiturates and GABA, yup, we can open the chloride channel. Chloride comes in, hyperpolarization or inactivation, so that you may calm down. Benzodiazepines, the most frequently prescribed sedatives and hypnotics. Mechanism of action, they bind GABA A by positive allosteric modulator, and they increase frequency. That's an important word. They increase frequency of what? Chloride channel opening. Therefore, I'll have increased chloride influx coming into the freaking neuron. When the chloride, the negative, comes in, this will lead to inactivation or hyperpolarization. This will lead to decreased action potential. That's why you calm down. Benzo cannot open the chloride channel without the GABA. Benzo binding sites include, these are sites on the freaking GABA A receptor. If you bind to alpha 1 and alpha 5, sedation, ataxia, amnesia. Alpha 2 and alpha 3, anxiolytic and anti-seizure. Alpha 4 and alpha 6, benzos, has no activity on these receptors. Here is GABA alone. Okay, so here is a closed channel. Here is when it opens. Closed, and then it opens. Closed, it opens. Closed, it opens. But look at GABA plus benzo. Oh, these are the 2 keys together. Open, 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 open. I increased the frequency of chloride channel opens. They are opening more often. I'm increasing the number of openings per second. Now, in the next video, we'll talk about barbiturates. Barbiturates will not increase the frequency. They will increase the duration of chloride channel opening. And you will see the opening like this. We go down and look at this. We have increased the duration of the chloride channel opening. Please don't forget that most benzodiazepines have active metabolites through the CYP3A4 and 2C19 systems in the liver. Oxazepam and lorazepam are directly conjugated, and they have no active metabolites. Side effects of benzos are extremely important. Okay, you calm down a lot. Drowsiness and sedation. Rebound insomnia, because like when you give me benzos, I calm down and sleep. No benzos, oh, I rebound insomnia. Motor incoordination, I'm too calm, it's unbelievable. Anterograde amnesia. I cannot remember what happens after I took the benzo because it's anterograde. The opposite is retrograde amnesia. Example of a retrograde amnesia: I hit my head on the curb or the pavement and then I could not remember anything about my past. This is retrograde amnesia. Coma and respiratory depression, and this is especially true when we use benzo with other CNS depressants. Don't ever give benzos with barbiturates. That's too much sedation. Do not give alcohol with benzos. That's too much sedation. Treatment, supportive care. What's the antidote of benzodiazepine toxicity? Flumazenil. It's non-selective benzoyl inhibitor. It doesn't care whether it's alpha 1, alpha 2, alpha 3. Who cares? We use flumazenil in case of benzo overdose. Flumazenil is of no use for barbiturate intoxication or alcohol overdose. Please be careful. Sudden benzodiazepine withdrawal will lead to withdrawal seizure. It makes sense. Benzodiazepine will make you calm down. When you remove the benzos, I suddenly get excited. I can get seizure. How can we prevent this? Before you take away the benzos, give me an anti-seizure medication such as carbamazepine. Clinical uses of benzodiazepine. They are anti-anxiety and they are sedatives. Anti-anxiety, so we can use them to treat anxiety, sedation before you go into surgery, panic disorder, status epilepticus, seizure disorders, alcohol withdrawal, and these are your examples of the benzos. We have short-acting such as midazolam, oxazepam. Intermediate, alprazolam, lorazepam, chlordiazepoxide. And the long-acting, clonazepam, clorazepam, diazepam. See how long that is? Or you can use another mnemonic. So, MO, this is Missouri, a very, very tiny state. So it's short acting. How about the intermediate acting? Chicago is kind of in between. How do I remember? You can say, I live in Chicago, or Chicago is in Illinois, which is in America. So ALC. And then the long acting is CDC. And as you know, CDC is Atlanta. And Atlanta is written in a way that's longer than Chicago for whatever reason. Okay, how about sedation? For sedation, triazolam can help, temazepam, estazolam can help, florazepam, and quazepam. Short-acting, intermediate-acting, long-acting. Okay, how about other benzos? Or we can call them the Z drugs or the non-benzo benzos, which is weird. Okay, these are not benzodiazepines. All of them are short-acting. What are them? Zolpidem, zaleplon, zopiclon. So they are the Z drug. Zolpidem, zaleplon is zopiclon. Mechanism of action, agonist on the GABA A receptor, and therefore they do what? They make you calm down. They are the number one, the drug of choice for short-term management of insomnia. What's the antidote to too much zolpidem, zaleplon, or zopiclon? Give flumazenil. Anxiolytics. Let's dig deeper. These drugs are class D for pregnancy. What does class D mean? Horrible. Class A is the best. B, C, getting worse. D is horrible. X is just forget it. Class D, teratogenic, only use in life-threatening emergency. What is the half-life of these short-acting? Less than 6 hours. Intermediate-acting, 6 to 24 hours. Long-acting, greater than 24 hours. Clinical uses, they are called anxiolytic, so anti-anxiety, and pre-operative sedation. The freaking anesthesiologist want me to calm down before surgery. Benzodiazepine. What are the benzos that you can use for anxiety and pre-operative sedation? Chlordiazepoxide, diazepam, lorazepam, and midazolam. Midazolam can be used to trigger anterograde amnesia, induction of anesthesia, and it has a freaking FDA black box warning. It can cause respiratory depression and respiratory arrest. Lorazepam can also trigger anterograde amnesia. For panic disorders, you can use alprazolam or clonazepam. Alprazolam is the only benzo that you can use for anxiety associated with depression. For status epilepticus, clonazepate, and please don't ever forget diazepam for status epilepticus. This is seizure that's not going away for more than 5 minutes. Seizure disorders, diazepam or lorazepam. Alcohol withdrawal, chlordiazepoxide, oxazepam, clonazepam, or diazepam. Please avoid sudden withdrawal of benzodiazepine, otherwise they can lead to rebound insomnia and withdrawal seizures. These sedatives are class X for pregnancy. Don't ever do it. Don't ever give it to a pregnant woman. Stop it. How about those Z drugs, zolpidem, zaleplon, zopiclone? They are class C for pregnancy. They can lead to drowsiness, motor impairment, parasomnia, which is somnambulism. Basically, this is sleepwalking, is a means condition. Ambula is to ambulate, which is to walk. That's why we call it the ambulance, because it walks quickly. And somn means sleep. I'm walking while sleeping. CNS depression can happen. Again, it's an additive to other CNS depressant. Do not give zolpidem with another benzos. This is too much CNS depression, doofus. My favorite part of the lecture, pearls for the pros. Alprazolam is the only benzo used for anxiety associated with depression. Zaleplon has little to no abuse potential. It's not like 0%, it's just little abuse potential compared to the others. Used when needed for insomnia. Please be very careful. Sudden benzodiazepine withdrawal can lead to withdrawal seizures. How do I prevent it? Give carbamazepine before withdrawing the benzodiazepine. It has a good ring to it. It rhymes. Give carbamazepine before withdrawing the benzodiazepine. Thank you for watching. I'll see you in the next video.